Hi, I'm Doug Rex. I'm the Director of Endoscopy at the Indiana University Medical Center, and I want to tell you about a recent paper that we published in Gastrointestinal Endoscopy that addresses the issue of whether adenomas that are in the 6 to 9 millimeter size range have greater predictive value for advanced neoplasia at follow-up compared to patients who have only 1 to 5 millimeter adenomas, or so-called diminutive adenomas. So this is clinically relevant because, as we all know, our current post-polypectomy surveillance recommendations say that if we have a patient who has an advanced adenoma, that is an adenoma 10 millimeters or larger, or having villus elements or high-grade dysplasia, or 3 or more adenomas, that we would stratify the interval for follow-up to 3 years in that group, compared to the patients who have only 1 or 2 adenomas 1 to 9 millimeters in size with only low-grade dysplasia and tubular adenomas. That group could go to 5 to 10 years. So we already know that size has some predictive value for advanced neoplasia based on a variety of previous studies that for the most part have lumped all these 1 to 9 millimeter adenomas together. So this study looks at, can we stratify further within that 1 to 9 millimeter size group? And we look specifically at the categories of 6 to 9 millimeters versus 1 to 5 millimeters, and we found that in fact we could. Patients who have either 1 or 2 adenomas total, of which at least one of them is in that 6 to 9 millimeter size range, have a statistically significant increase compared to those who have only diminutive adenomas. It stays true if there are 3 or 4 total adenomas, 5 or more adenomas that are all under a centimeter, but at least one of them is in that 6 to 9 millimeter size range. They have the greatest absolute risk. So there is some risk stratification that can be done in that category. Our group is not the first to have shown this. A couple of small studies showed it. And then recently Joe Anderson at Dartmouth, using the New Hampshire registry, also found that this was a predictor, 6 to 9 millimeter adenomas versus 1 to 5 millimeter adenomas. What's the clinical significance of this? Well, it's interesting that our current post-polypectomy surveillance recommendations say that if you have only 1 to 2 adenomas that are under 10 millimeters that have only tubular histology and no high-grade dysplasia, you actually have the option of selecting an interval of 5 to 10 years. And I think most of us select 5 years for that whole group. But perhaps we could start to stratify patients, especially now with our high-definition scopes, our emphasis on higher adenoma detection rates. We're finding lots of people who have really just 1 or 2 really tiny 1, 2, 3 millimeter adenomas. These patients appear to be at very low risk of an advanced neoplasm. Perhaps they could be stratified toward the longer part of that interval, patients who have at least 1 adenoma that is in the 6 to 9 millimeter range, maybe at the shorter end of the interval. I think that's one way that this could potentially be clinically relevant. And then we'll probably see additional studies looking at this and trying to answer the question of, should our future post-polypectomy surveillance recommendations make some even additional size stratification in the recommendations. So that's the topic of the paper, and I appreciate your interest in it. Thank you.